You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Hey everyone, this is Tony Dow, and welcome to another episode of Pharmacy IT and Me. As with every episode, we start with this one stating that the intended audience for this episode are newcomers to pharmacy informatics. So today we'll be talking about what is change management and how to handle it in terms of health informatics and healthcare information system changes. So this will just be an intro episode, and we'll continue this discussion another time as well. So what is change management? So when there's a change in the system to improve a process, there needs to be some controls in place. Everyone's used to doing something a certain way already. So that's their current belief. In change management, what you're trying to do is unfreeze their current beliefs, introduce a new workflow with, systematic changes and testing in the electronic health record, and then have the users refreeze their beliefs into a new norm. There are many challenges to introducing change, and, let's face it, many individuals just do not like a change in their ways. And in addition to that, there's the IT kind of definition of change management. So logging the change with change management tools that include additional documentation helps with future troubleshooting of the issue should something go wrong after the change has been implemented. So there are information system tools out there to help the process going by, creating tickets in the system that will need to go through a change committee review before they get implemented, and it has a certain, change plan and testing plan and all of that stuff. So let's begin with the scope of the change. For the sake of discussion, let's assume a new system feature has already been approved. How do you navigate this towards implementing the change in the system? The first thing is to identify and recognize the scope of that change. How is this feature going to be used? Who is using this feature? Will it be significant, a significant change from the current workflow? After you are able to identify the scope, you can start to identify the driving forces that are going to be pushing for that change to occur. Is it regulatory? Is it required by the Joint Commission? Is it requested by many users? And you also want to look at any restraining forces as well. So is there anything that's holding back from people adopting this and using it as a new feature? Is it too cumbersome? Is it not intuitive? The reason why you want to do this sort of scope analysis is so that you can understand the concerns and figure out how to address them. So the next step is understanding your organization's culture. Culture is actually a big thing, and it drives a lot of operational decisions that institutions may have. Understanding the culture is very important for change management. Cultures are beliefs and attitudes that drive the leadership and the users in how they respond and react to certain things. And by understanding the culture of the organization, you can also use that knowledge to address and strategize how you will implement the change. All right, so at this point, you have what you need in terms of pre-action. So now you will need to review the different change strategies and see what is best for your organization. There are different change strategies that are common, and some of them are norm-based, incentive-based, and sanction-based, and also adoption-based. So norm-based strategy, that uses the strategy of peer pressure. If you're using the strategy, you're basically leveraging the feeling of something like, so many of these other institutions are similar to us and they're doing this, they're using this feature, so why are we not doing it? We should do it too because that's the norm. So that's a norm-based strategy of implementing change. Another one is incentive-based, and this is what basically the meaningful use rules were about. It's basically, the government saying, hey, we have a bunch of money right now and we want to pay you, but we want to pay you only if you implement these features by a certain date. That's what we're going to pay you with. So that's the incentive. There's all that money, right? And then we have sanction-based, which is similar to incentive-based, but it's kind of like the reverse. It's basically saying, hey, if you don't do this, we're going to penalize you. So we're not going to pay you, or we're going to pay you less. Like, we're going to reimburse you guys less than what we normally reimburse if you don't implement these certain features by this time. And then the last thing is the adoption-based strategy. And this is more of a hands-off approach. It's the idea of, if you build it, they will come. And there's a big problem with this one is that if you leave the system open for, partial adoption, you end up with a hybrid system, which is potentially going to be leading to bigger problems of, not consistent documentation or not consistent workflow. So we're going to end the episode here because there will be more talk about it next time when we do an educational episode. So today was just the introduction to change management. Next time we'll go into some more detail with change agents and individual adopters and, responses and reactions and things like that. All right, if you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or Instagram at Pharmacy Informatics, or by emailing me at tony@pharmacyitme.com. And I also wanted to plug a great networking opportunity called Pharmacist Connect. If you are familiar with Microsoft Teams or Slack Workspace, think of Pharmacist Connect as a large vetted one through Slack Workspaces. I've met some great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.